Palmer from ASPPH. And before we begin, I'd like to go ahead and conduct a quick roll call. So when I say the name of your school, please let me know who's joining from your sub-project. We'll start with Harvard sub-projects 1 and 3.
Elena Savoya.
And Marcia Testa.
Great, thank you. Washington sub-projects 2 and 3.
Hello, you have Janet Baseman and Deborah Revere from Subproject 3.
Maddie Frost from Subproject 2.
And Molly Fader, working with Janet. And
Great. Great, thank you. Albany. Is anyone online from Albany?
Yes, Gus Burkhead and Mary Riley Hakame are on.
Hi, can everyone hear me?
Now we can. Yes.
Okay, yeah. I got kicked off, so hopefully that doesn't happen again. My apologies. I don't know what's going on, but hopefully it doesn't happen again. I think where we left off in the roll call was Arizona.
Jeff Burgess, University of Arizona.
Brenda Granillo, University of Arizona.
Emory.
And we got Allison Chamberlain and J.D. Leonard.
Thank you. Pittsburgh.
Hi, it's Elizabeth Van Ostren.
Thank you. And UCLA.
Hi, it's David Eisenman.
And Andrea Martel.
Thank you. And how about CDC?
Hello, this is Shaukat Kari.
Hello, this is Mary Linehouse. And hello, this is Tracy Thomas.
Great, thank you. And I believe we have some staff from NORC on the line as well.
Hi, this is Noelle Miesfeld. And hi, this is Alexa Siegfried.
Great, thank you. So thank you all again for calling in today. Today we will hear some updates from ASPPH and CDC as well as NORC. We'll also have an opportunity from our colleagues at UCLA to provide a quick recap of their recent site visit with their project officer. And then we'll have a discussion about communicating your project to the right audience or audiences, which will be facilitated by Allison Chamberlain from Emory. So we'll go ahead and get started. Brian, next slide, please. And actually one more. Thank you. So just as a reminder, we will be holding a one-day in-person grantee meeting on Monday, April 24th from 10 a.m. to 5 p.m. at the Summit Hotel, which is the Atlanta Marriott Marquis. I sent a calendar invitation last week, so hopefully all of you have gotten that on your calendar at this time. And please just ensure that each sub-project has at least one representative in attendance. In addition, our NORC colleagues will also be participating, and we're working to finalize that agenda, and we'll get that to you as soon as it is ready, hopefully next week. Also, we are actually in the process of researching the possibility of having an exhibit booth at the summit so that those of you who may have products you'd like to share or test with potential knowledge users can use the booth to reach practitioners. I know that we have interest from one sub-project already, and I just wanted to take a second to see if any others would be interested in a booth if we were to get one on behalf of the entire project.
UCLA might be interested if our product is ready.
Okay.
This is Harvard. I think we've actually rented a booth already.
Okay.
I think, but I'll check whether we paid.
Sure.
Yes, we did, yeah.
Okay.
This is the University of Pittsburgh. We would be interested.
All right, great. Well, it sounds like there's enough interest. So what we'll do is go ahead and look into it. We think it's feasible. So we'll let you all know as soon as we can. But, you know, in Harvard, if there's a way, if you all wanted to see if you could get your money back and go in with us or split it up, we can talk about that as well.
Sure.
But sounds great. So thank you all. And I think, as you all know, we're still waiting for our session assignments to be made by NACCHO. I've not yet received ours, at least. So once we receive those, once I know they've gone out, what we'll do is put together a schedule of events to share broadly. And if we do have a booth, you know, we can talk about trying to schedule time for everyone to take a turn at the booth for those who are interested. So we'll work on getting that arranged too. Also, I know I keep talking about this, and it's a work in progress, but we're continuing to work on determining a journal supplement, and if it's possible to publish with the American Journal of Public Health. We're trying to set up a call this week with the editor-in-chief to discuss it a little bit further. As a reminder, the purpose of the journal is to document your contributions made to public health preparedness, especially the workforce. And also the progress made but to address the translation gap from research to practice. Once we have more details, I will get those to you as soon as possible, give you all as much leeway as possible. I think that's it from the ASPPH side. Are there any questions? Okay. Shaukat, did you have any updates from your end that you'd like to share?
Thanks, Rachel, but we don't have any updates this time.
Okay, great. Brian, if you could go ahead and advance a couple more. Perfect. I think, Noelle, I'm turning it over to you at this point for NORC updates.
Thanks, Rachel. So we just have a few. We are in the process of finalizing the evaluation plan with ASPPH and CDC. We also submitted our plan and interview protocols to our NORC IRB and expect it to be approved as exempt for program evaluation. And as you all know on the phone, we have reached out to you guys to collect some contact information for our intended knowledge user interviews that we expect to conduct around May. So we'll let you know when we're going to be reaching out to those individuals. And we'll be at the Preparedness Summit. We're planning on conducting some focus groups with potential knowledge users. We reached out to NACCHO and ASTO to help us recruit federal, state, tribal, local, and territorial public health department officials to participate in those focus groups with us. So we're in the process of collecting those names now. And those are all our updates for today.
Thanks, Noelle. Are there any questions for Noelle? All right, moving along. I'd like to actually give an opportunity now for UCLA to provide just a quick recap about their site visit with their CDC project officer. So I will turn it over to either David or Andrea.
Hey, hi, it's David Eisenman speaking. We had a very successful site visit with Mary Linehoff. It was a two-day visit. On Thursday morning, we met the UCLA team and our subcontractor with who's the RAND team with Mary. We spent the morning going over the project, and then spent some time in particular detail on one of the products of the work we're doing, which is what's called a Getting to Outcomes manual that helps. Its purpose is to facilitate public health departments and other agencies that are interested in adapting disaster preparedness programs for their own use in the community. So we spent some time on that, and then we spent the afternoon outlining a paper. We've actually already outlined, but getting more deeply into the paper and what are kinds of sort of the structure of the paper. And very productive day. Mary gave us a lot of fantastic feedback. I think it was helpful to her to see some of these things too. Then the next day was Friday. We took her on a forced march through Southern California as we went to two of our partners' agencies to do our trainings with them. One in Long Beach, and then the next one in Orange County. So that's an all-day affair. So she experienced, she sat in on the trainings, got a sense of what working with our partners entails, and the kind of work we're doing. And then that was really a full-day event.
Great, thank you. Mary, did you want to add anything?
Yes, can you hear me?
Yes.
Great, thank you. Thank you, David. Yeah, it was a very productive visit, and always good to meet in person and kind of take the time to look over things carefully. So I'm really excited about the Getting to Outcomes product that's being developed from this project. It's going to be a great resource for the preparedness community, and it was really great to have the RAND partners there to give some background on the Getting to Outcomes approaches and past experiences, and how they're customizing the manual and the training materials for community resilience. And also we talked a fair bit about the importance of providing technical assistance for this, and how different health departments are very differently positioned and need, kind of customized technical assistance in order to make this work. It was great to do the site visits, and also to get a little bit of background on the different health department partners that are working on this project. And as any of the other sub-awardees who are working with health departments know, there's lots of challenges for this, and of course, I'm aware of them from progress reports and other conversations we've had, but kind of seeing it in person and getting a more detailed look at what's going on really kind of drives some of the points that turnover in health departments is a problem, both for these sorts of collaborative activities that we're hoping to do, as well as just health departments pursuing their own programs and improvements. So that's a big challenge. And it's also good to see, how each health department has kind of configured differently in terms of how other sorts of people that are involved in these projects, whether it's different professions or different ways that the health department might be configured, and just the different particular local interests that they're pursuing in conjunction with the project. So it was really great to be there in person and to talk with the UCLA team and see everybody and talk about the paper and some of the challenges that we've been looking at there, and kind of paved a way forward, and it was really good. So thank you.
Great, thanks, Mary. Are there any questions for either David or Mary? All right, well, now we'll go ahead and move along to the main discussion topic for today. Brad, if you can go ahead and advance. Thank you, yeah. So Allison Chamberlain of Emory actually offers to lead a discussion about strategies and potential barriers to reach your project target audience through dissemination efforts. As noted earlier, we will be working on a journal supplement, so we're obviously strongly going to encourage you to submit abstracts about your project to that. But Allison really wanted to spend some time to talk about other methods and the importance of reaching your target audiences. So with that, I will go ahead and turn it over to Allison.
Great, thank you, Rachel. Can you hear me?
Yes.
Okay,
we can hear you.
Okay, so if somebody would advance to the first slide of my slide set. Very great. Okay. So as Rachel said, today I'm going to talk a little bit about how to reach your target audience with your particular project. And I'm going to be talking a little bit from an example or an experience that we had at Emory, where it kind of made us think about who our target audiences were for a particular sub project we were working on. And I say that because we kind of pivoted a little bit when Zika came, and we found ourselves in a little bit of a conundrum with who our target audience really is. So if somebody wants to advance to the next slide. So in terms of the overview here, public health preparedness obviously involves a variety of stakeholders. So you can click the next slide. We sort of created this schematic here. JD helped me do this, and it probably doesn't capture everybody, but it really shows the vast sort of landscape of the different types of people that might be interested or involved in public health preparedness efforts. And when you're thinking about who you're disseminating these research products to, there's sort of a lot to consider with who these target audiences or stakeholders actually, or what resources they go to get information about public health preparedness efforts. Next. So trying to figure out what the best avenues are to reach both stakeholders and knowledge users is critical for understanding how best to translate and disseminate our tools. Next. And as researchers, I think I'm learning exactly what the best ways are to get our products into the hands of intended users. And I think that the theme here is what happens when you have target audiences or intended users whose primary modes of getting information don't really overlap with each other. So next. So some of the complicating factors, you can go ahead and click through these if you want. So stakeholders in different sectors frequently utilize different means of acquiring information. They could be by, they do things that involve more conference-based type learning, or they're reading particular sort of industry journals, so to speak, like within their particular profession. Research products may have multiple target audiences, like I mentioned before. And then, stakeholders that you want to target, they don't always communicate with one another. And I think in a public health emergency, there might be situations, when there is an imminent threat where they do start communicating with one another a little bit more. But on a day-to-day basis, and in terms of how they like to stay up to date on research and information, it's not always they're not always collaborating with one another. Next slide. So this is the example that I was talking about. When Zika first came along, we pivoted on what the Link to MomVax project that we have as part of our sub-project 3. And we replicated a study that we had done back in 2014 to look at whether or not OBGYN practices were using their websites as a way to educate their patients or the public about Zika virus information. And so, next bullet. Our hypothesis here was that healthcare providers should and ideally would be using all available means of communication during a public health emergency that was obviously directed, that was obviously affecting their primary patient population. And so we undertook this particular review. We ended up doing, getting a random sample of 1,000 OB practice websites from around the country, and we looked at whether or not they were utilizing their own practice websites to educate women about Zika. We did one review in January and then another review in August. And those particular time points were chosen because it was right when Zika sort of first hit the map in January, and then again in August because that's when the first report of localized transmission was at the end of July here in the United States, in Miami. So we decided to see if they were using their this existing communication platform for Zika virus information. Next bullet. So we ended up doing this study. We found that back in January, only about, I think, around a quarter of OB practices were utilizing their websites for provision of Zika information, and then it increased to about 36% in August. But still, you're looking at about 63% that weren't utilizing this resource that 85% of OB providers already have. So when we went to sort of communicate the results of this quick and dirty sort of study that we did that was part of our project, we really thought, we kind of ran into the situation of who is our target audience here? We obviously have public health practitioners who are, trying hard to create useful risk communication materials for not only patients, but probably for healthcare providers at the time. CDC is doing this, state health department's doing this. And then you also have sort of your end game knowledge users as the OB providers themselves. And so we sat down and we thought, okay, well, what journal are we going to target for this? And, go to the next slide if you would. So public health practitioners, they generally get their information sources, public health related journals, AJPH, Journal of Public Health Management and Practice, epidemiology, things like that. Then they also get their information from the CDC, and then we thought conferences, Preparedness Summit, more local district level conferences that might have more immediate impact to their local communities. We've been to some of those here in Georgia. And then click to the next. Then you have sort of your obstetric care providers information sources. So they have their sort of two or three premier obstetrics journals that they read. And while they too will get information from the CDC, typically like to see that funneled through their professional association. So the American College of Obstetricians and Gynecologists, the similar association for certified nurse midwives, conferences that are sort of more medical or societal in focus. So they'll have their ACOG conferences and their particular subspecialty conferences, that kind of thing. But it's very medically focused, not so public health. And if you click to the next slide, the next one, so sorry, this overlapped a little bit. Go back. Okay, so this is a little overlapped. I kind of did this sort of quickly, but you'll see that we ended up landing on the, presenting some of our preliminary results at the 2016 Georgia OBGYN Society meeting. And this was fantastic, but it was only really fantastic because our Commissioner of Health is an OB. So this was nice because we were able to present at a meeting that really kind of captured the end knowledge user in terms of the OBs, but the sort of the overarching message was heard by a preeminent public health, entity for our state. But she has this background, so she was there too as an OB. So if you click to the next slide. So, that doesn't necessarily, that was sort of a one-time thing, and we're really fortunate for this particular situation that we have Dr. Fitzgerald, who is an OB, but that doesn't always happen. So public health information tools for clinical providers are often created by public health practitioners. So, like I mentioned, for something like Zika, it's an emerging threat. The public health and public health, people who are involved in public health preparedness, risk communications, they have sort of that purpose and the time to put towards creating those risk communication materials, often for the public and for providers themselves. So next bullet. And if you do one more. So you have sort of this triangle of public health practitioners, healthcare providers, and patients in this particular sort of example. And as we were thinking through where are we going to sort of publish this information or our findings, we decided that we would act on at the start of the pipeline for a public health emergency like this in terms of communications. So if you go to the next one, we chose, we thought that would be public health practitioners. They would have the time and energy to devote to really seeing this problem and working to help OBs who are already overstretched to try to maybe make some headway in doing things that would help them utilize existing modalities like their websites, among other things, to be more effective conduits of public health information during an emergency. So we ended up publishing in the Journal of Public Health Management and Practice, but that wasn't without sort of our, a lot of discussion about, God, this would be great to get into an OB journal. I mean, our target audience are these OBs, they're the ones that are going to have control over their practice websites. They should see this message as well. So one solution that we had in this particular case, you can go to the next one, was to, publish our primary findings in that public health journal. and then try to submit an editorial to a provider journal, something that would be a little bit more action-oriented for providers that would sort of summarize key, key resources and websites and widgets that would be useful for them to actually post to their websites. So we had a correspondence with an editor-in-chief of a major obstetrics journal to try to work through that. We submitted something. What was interesting is she said, I think it's a great idea. We ended up submitting our editorial for, like a little brief piece essentially that went through, that highlighted our findings that we published in the Public Health Journal, but that made it sort of more action-oriented for the providers themselves. So I think this was one good solution. Now, with that said, the little short piece that it ended up going out for peer review and actually ultimately ended up getting rejected, which was a little bit of a bummer. But I still think that this particular solution is one that might be good. And as we look towards, a potential supplement with either AJPH or another journal that ASPPH is able to sort of to narrow down to, I think that that's great that, for some of us who have this multiple audience issue, to go through that supplement, but also what are some other ways that we can get the word out and the message out to sort of the other, quote, target audience. I don't know if this was the last slide or if there's one more. You might click. So yeah, so some discussion questions here. What are the most efficient methods to disseminate research products with multiple target audiences, especially when these target audiences read very different journals and attend very different conferences? And how do you best reach audiences that, and I put this in parentheses, sort of understand themselves to have minimal overlap with public health during their day-to-day activities? And I put it that way because I think that in the world of obstetrics especially, I think that there's a lot that needs to be done to sort of make providers themselves realize their power when it comes to promoting public health messages. So they currently might not see themselves as being sort of an important conduit of public health information on a day-to-day basis, but definitely they would be during a public health emergency that directly affects their patient population. So I'll leave it here, but this is just something that I wanted to share with the group because I thought this was an interesting sort of experience that we had, and if other grantees have had similar experiences or have tackled this issue as well, love to sort of hear your thoughts.
Hi, this is Mary from Albany. I was going to talk about something similar. I mean, our PFA project is, a wider range of people, but as far as for the medical, we actually took some in a project on the health impacts of climate change or extreme weather. We actually took some of the messages and tried to distill them and then asked the medical society. They have a emergency preparedness work group, and so they disseminated the draft messages through each of their specialties and asked them, for example, we had some messages about OB for OBs and their clients and patients, and so they came back and said, oh, this message isn't exactly right, So we sort of gave them the research, we condensed the research, and then asked them to look at the messages that we came with and give us some input of it. And those were a way, and then they also told us which types of things they use to disseminate the messages to their clients as well, or the patients. So like text for baby if you're a OB.
Right.
So that was one just specific thing, but actually the medical society as a whole, which it has an emergency preparedness section, they work on that, and they do conferences and training on that all the time for people like me. So that's just one thing on the medical side.
Yeah, and this is Gus in Albany also. I think the H1N1 2009 pandemic was really the first introduction to OB. I mean, I think Zika's probably replaying that now, but back in the 2009 pandemic, we used the state ACOG chapter heavily to communicate with physicians. Then we were trying to sign up OBs to actually be vaccinators.
Right.
And I think that experience has formed a good foundation for continued communications. ACOG has a state newsletter as well. We spoke at their conferences. I think when you're talking about national journals, you probably CDC would have better luck on some kind of a communication. The MMWR is typically where things are published on something like Zika or H1N1, and then getting an editorial into OBJ-ACOG or whatever would be the way to, I think, reach them. Probably something easier for CDC to do than I'm speaking from a state perspective, than a state or a single school of public health perspective.
Right.
So I think the history is there with OBs, I think, dating back at least to 2009, and it's you need to sort of foster those relationships and keep them going, but there's a good precedent there for that.
Right. So going back to the comment about the medical society, was that, who was it that mentioned this?
This is Gary from Albany.
Yeah, so was that a state level medical society, like or was that, is that what it was you're talking about? Okay.
State level medical society, which the state health department provided funding to have a preparedness committee and to put on preparedness activities, conference calls mostly, I think, but also in-person meetings for their members. Now that's a limited reach. The medical society in New York doesn't have all physicians on it, but at least it is a physician group. You think you need to work with the specialty societies also.
Yep. Okay. But if there's even other examples of other grantees that have, even different audience groups that I'm not even thinking of right now that are different from clinicians, but also sort of read different journals or sort of get information in other ways besides the way public health does.
This is Marcia Testa from Harvard. First of all, I want to commend you on bringing this idea up because it's such an important component of education in public health, is trying to reach the appropriate audience. And I was sort of taken back by when you said it didn't get accepted in a journal. And I think that also reflects another issue, is that even those people doing research often don't know what's important for target audiences.
Yeah,
so,
it was a very interesting back and forth with the editor of that journal because she was very interested in me writing this. She actually solicited it, and then when we wrote it, there was the peer review, where there was a few peer reviewers who saw the value in it, and the others were, it just fell totally flat. And the ultimate decision, I guess, was to reject it. But I thought, I guess it shows you the importance of the peer review. If the peer review worked in that case, the peers.
I think the peer review probably didn't realize that there are people out there that desperately need information like this. And I'm also thinking about another target audience, and that's the target audience that does not read journals and that does not read research, but desperately needs this, and that's the practitioners at the local level, often who are in health departments. So how do we reach them? And I know NACCHO has toolkits, but I often wondered how many people actually go to that. So some more direct messaging to public health department, who really, if you look at that particular workforce, they're out of the picture of almost dissemination completely, unless they have the meetings with the FEP meetings that regions have, and that's probably where they get most of their public health education is at the monthly meetings they had with the preparedness groups. So I just wanted to commend you, and if I were editor of a of a journal, I would publish it. so I think you do need to find another journal for a platform, and maybe having a supplement, or even people getting more involved in practice journals would be helpful. But I just thought it was very good work.
Thanks.
I just want to say one thing. This is David Eisen from UCLA. I spent 4 years working as a science officer in Los Angeles County Department of Public Health. When they switched directors, the new director came in, and in the 2 years under that director's leadership, I never saw that director once crack the AJPH journal that came into the office. I think it's really in emergency preparedness, and I want to give a little cultural background to that. I think that's because a lot of emergency preparedness people, in my experience, come from more of an operations point of view, and these journals just do not meet their needs. They don't find anything of operational value. So I think, Marcia, you're right, to get it from briefings and they get it from meetings. They get it from, you know, the grapevine, but they do not get it from the universities or even the journals.
Yeah, that's right. That's one of the reasons why we ended up from your point about you know, a operational standpoint. That's why we targeted public health management and practice with that paper, because we thought of all the public health journals that would sort of get at that point the most. But again, I think your point though is that they're just not reading journals. Depending on the you know, the director or whoever it is, they're not reading journals necessarily. So that's why we, in addition to, you know, but as an academician, you know, it is, you know, it's worthy of publishing, so we wanted to go that route, but we're also doing sort of the more grassroots type outreach where I went, you know, and present to OBs at Piedmont Hospital in Atlanta. So there's that kind of thing, but that's just a one-off type thing, you know, I mean, you can only do that so much. So anyway, yeah. I don't know if there's any other comments, but I appreciate y'all listening and your feedback. That's great. Great suggestions and stuff.
All right. Well, thank you, Allison. That was really just very timely, considering we're going into the last part of the project. And at the grantee meeting in April, we'll have some time to further discuss dissemination strategies. So I think this was a good way to kick that discussion off and kind of everyone put your thinking caps on, and we can discuss again in a couple of months. So thank you again, Allison. I appreciate it.
Sure.
Hi, this is Deborah Revere. Can I just interject something from another project that might be of use for grantees? The Medical Library Association has for a couple of years, well, probably about 5 years, conducted the Core Public Health Journals project. It's through the Public Health and Health Administration section of the Medical Library Association. And they do a rigorous review with librarians of both the gray literature and peer-reviewed literature, looking at from both for both research and for practice, best journals to include. And it's targeted to librarians for building collections. But I can send, Rachel, I can send you the link to that information because folks here might be interested in taking a look at the journals that are included and a variety of ways to disseminate research and practice-based research information that's going to be generated from all of our various projects.
That would be wonderful. Please do send that to me, and I'll make sure to get that out to everyone.
Thank you.
Any other comments or questions about this topic in particular? All right. Well, we have about 20 minutes left. If anyone has any additional questions or updates you'd like to share with the group before we dismiss for the day, we've got time for that at this point. All right. Hearing none, then, Brian, if you could forward a couple of slides, please. Our next meeting will be on Monday, March 27th at 12 p.m. Eastern, and I will send an agenda prior to that call with the agenda items for that meeting. In the meantime, if you have any questions, feel free to reach out to me, and I will be sending information about the grantee meeting as well as a booth if we are able to secure one. So I'll keep you all updated on both of those items. And thank you all for joining today. I hope you have a good rest of your day.
Thanks.
Thank you.
Thank you. Bye-bye.